Now I start scanning of right iliac region or right lower abdomen part. Here we see a echogenic line. This is a gas shadows in the small intestine. Now here is also some part of intestine is dilated, and we see a echogenic line. This is a mucosal layer, and hypoechoic line. This is muscular propria of the small intestine. Some part of small intestine is mildly dilated and gas shadows are absent. We see a peristalsis. Normally, the walls of intestines are not visualized and obscured by gases, but here we see the small intestine is dilated and walls are appreciated, which shows mild inflammation of walls. Now here we see a gas. This is normal part of the intestine. Normally, gases in the small intestine are visualized as a continuous echogenic line. Now here we see a rounded mass anterior to the muscles layer. Now when I rotating my probe at its longitudinal axis, we see a tubular structure. On compression effect, patient is feeling pain here. Here we see fibers of the iliac muscles, which are hypoechoic and hyperechoic posterior to this lumen. Here we see a echogenic area around the lumen. These are inflamed tissues around the lumen. Now if we see the lumen is connected from other side to the cecum. Now how we will write report. The appendix is inflamed and its anterior posterior diameter is 7.5 millimeter. No peripendicular fluid is seen. The ultrasound diagnosis is chronic appendicitis, as the patient has complaining of pain in the right iliac region for 3 months, which is subsided by anti-inflammatory drugs. The patient is referred to surgeon for treatment.